Hi, this is for my CXA243 assessment task 2 video presentation. So I have here Mehmet. He is a 62 male, currently diagnosed with T2 diabetes mellitus. He is also considered high risk in cardiovascular disease and also presenting signs of stage 1 mild kidney damage. However, in his recent renal scan, his kidneys are still working well. So the therapies are recommended for him is metformin and empagliflozin. So metformin is an oral anti-diabetic medication that is belong to biguanide drug, and the mechanism of action is to reduce the glucose production of liver by activating the adenosine monophosphate protein kinase, or AMPK. So once AMPK is activated, it will promote synthesis of neogenic enzymes, resulting to increase in insulin absorption, insulin sensitivity, and decrease in intestinal glucose absorption. So the aim of the therapy is to reduce the amount of sugar the liver releases in the blood and makes the body responsive to insulin. So Mehmet's pathological presentation will also change, as metformin promotes weight loss due to its ability to delay gastric emptying, and also metformin also prevents hypoglycemic events. So the risk of use of metformin might lead to lactic acidosis due to Mehmet's mild renal problem. And according to Diabetes Prevention Program trial, lifestyle intervention and metformin reduces the diabetes incidence by 58% and 31% respectively. So empagliflozin is a sodium glucose transporter 2 inhibitor, and it is a newly developed anti-diabetic drug to enhance renal glucose excretion, or glycosuria, and reduces hyperglycemia in an insulin-independent manner by highly selective inhibition of SGLT2. So the mechanism of action of empagliflozin is inhibiting the sodium glucose transporter 2 that is found in the proximal tubules in our kidney. So through this inhibition, empagliflozin reduces the renal reabsorption of glucose and increases urinary excretion of glucose. So the aim of the therapy is to improve glycemic control and reduce the risk of cardiovascular death and heart failure. So the precaution with the use of this drug includes ketoacidosis or excessive thirst, nausea, vomiting, and abdominal pain. So according to randomized controlled trial, it has shown that there is a reduction in heart failure, hospitalization, also a reduction in the progression of renal disease despite the initial reversible elevation in serum creatinine, and this medication also reduces HbA1c. So the therapeutic intervention that I recommend for Mehmet is dietary planning. As we all know, in T2 diabetes mellitus, the body does not make enough insulin, causing a high blood sugar level, resulting from imbalanced lifestyle such as being overweight, high sugar intake, insufficient physical activity, with additional factors such as the age, inheriting the disease, and other disease. So over time, the body cannot compensate with the changes, which is evident in Mehmet's presentation. So a dietary planning is that indicates a controlled intake, or a diet that consists of a low carbohydrate and a low sugar meals is recommended while taking these medications. And the goal is to promote good sugar level, encourage consistent day-to-day food choices, including a variety of food, and maintain a healthy weight. So while empagliflozin works in the kidney, reducing by prevention of absorption of glucose, and metformin reduces the absorption of sugar from the stomach and technically reduces the release of stored sugar from the liver. Mehmet must do his part in supporting his medication's action in his body. Each medication has a weight loss effect, so losing 5 to 10 pounds is often the first step in controlling diabetes, and consuming the right amount of food is necessary.